Welcome back to KXAN News at noon. We're joined by Dr. Jennifer Walden, a cosmetic plastic surgeon here in Austin. But we're not talking about the typical plastic surgeries you hear about. Today, we're talking about plastic surgery for kids. So first of all, what kind of procedures are we talking about here that kids or even teenagers might come to you for?
We're talking about procedures for certain anatomic problems that even teenagers and kids have, like otoplasty or ear pinning for prominent ears, a rhinoplasty or nose reshaping for someone who has a large or crooked or beaked nose, male breast reduction for teenagers who have breast enlargement, who are young men.
Okay. And why, though, would kids come to you for this? I mean, as we said, it's kind of a sign of the times. What is the reason behind all of this?
Well, it's nothing new. These procedures for young children and teenagers have been going on. We do see a lot of it in the media, a lot of photo sharing on Facebook and Instagram, but people get these things for significant embarrassment, distress, anxiety, and sometimes even depression related to bullying and teasing. A 6-year-old child being called Dumbo, for example, is not a real nice thing. And a surgery procedure such as an otoplasty or ear pinning only takes 2.5 hours and can actually help that child in a short amount of time with those anatomic problems that they may have. It's not a cure-all, but it can help for certain specific problems.
Right. And a lot of people are going to watch this and think, I mean, come on, plastic surgery for kids or teenagers. So how do you talk with parents and the kids to make sure this is the right decision for them?
Well, it's super important for everyone to be on the same page. A pediatrician needs to have approved of it. Clinical psychologist, possibly even a psychiatrist could be involved in the process. Parents need to give consent, and the child, very importantly, needs to understand and want that done. They need to be relatively mature for their age and understand that they may have to take time off of camp or sports activities, and that this is something that will change the way they look forever.
Yeah, and understand it might not be a cure-all.
Absolutely. I mean, with bullying, the perpetrator is the one who has the problem, really. School administrators, teachers, parents have to get involved in some type of a systemic problem like that.
Right. All right, doctor, thanks so much for joining us. We really appreciate it.